Understanding the female reproductive system requires a deep dive into the microscopic world of endocrinology. If you have ever wondered exactly how the female body produces its primary sex hormones, you must look closely at the ovaries. Based on the insightful breakdown from the educational video, Estrogen and Progesterone Production by Theacal and Granulosa Cells. This article will explore the fascinating synergy between different ovarian cells and how they orchestrate the female hormonal cycle. Here is a detailed, step-by-step analysis of how these vital hormones are synthesized.
Our topic today is Painful Bladder Syndrome, which is also known as Interstitial Cystitis. Painful Bladder Syndrome, or PBS, is a chronic condition that causes pain and pressure on the bladder and around the pelvic area. Studies estimate that between 3 and 6% of women in the United States have symptoms suggestive of PBS. Women are 5 to 8 times more likely to have PBS than men. PBS most often occurs in those between the ages of 20 and 50 years. There are 2 main subtypes of PBS. One subtype is PBS with Hunner's ulcers, sometimes called Hunner's lesions. These are areas of distinct inflammation on the bladder wall and occur in roughly 5 to 10% of cases. Another more common subtype is PBS with just glomerulations alone. Glomerulations are areas of bleeding in the bladder wall lining. PBS is typified by urinary frequency and urgency that is far in excess of the usual need to urinate. It is not unusual for a person with PBS to urinate as often as 50 times during a 24-hour period, both day and night. This definitely has an impact on quality of life, as it is difficult to hold a full-time job. Most end up only being able to work part-time. The pattern and intensity of pain associated with PBS varies widely among individuals and may change over time. Most often, the chronic suprapubic pain is constant and intensifies during urination. Typically, the pain is temporarily relieved after bladder emptying. Patients also experience pain during intercourse. Men often have pain in the scrotum, and women tend to have more intense symptoms during the menstrual periods. All of these symptoms occur in the absence of bacterial or viral infections. A healthy mucin layer of the bladder wall includes a substantial glycosaminoglycan layer, abbreviated GAG, that helps protect underlying bladder wall structures. It is believed that defects in the mucin layer allow solids and toxins from urine to leak through the outer layer and penetrate the urothelium to agitate underlying tissues of the bladder, resulting in the characteristic glomerulations of PBS. Nerve receptors are also activated by these solutes and toxins leaking through, and cause the characteristic pain associated with PBS. It is not known what initially causes these changes in the GAG layer, but several ideas have been proposed and include the autoimmune, neurologic, and infectious theories. Genetics, allergies, and stress also seem to play a role. Individuals with PBS also often have fibromyalgia, which may include symptoms such as pain, sweatiness, blurred vision, hunger, and headaches. Other conditions affiliated with PBS include allergies, as mentioned, and migraines, irritable bowel syndrome, and chronic fatigue syndrome. In order to diagnose PBS, urinalysis is performed to assess color, odor, and to test for the presence of blood in the urine. A urine sample can also be tested for bacteria that cause urinary tract infections. A cystoscope may be used to examine the inner lining of the bladder and look for the characteristic glomerulations and Hunner's ulcers. The bladder may also be filled with sterile water to maximum filling capacity. Those with PBS most often show a reduced maximum filling capacity. Increased pain with instillation of potassium chloride is a positive test for PBS and indicates urothelial dysfunction. Other conditions with similar symptoms as PBS are ruled out by a diagnosis of exclusion. Pelvic and prostate examinations help rule out STDs. Other tests are performed to rule out bladder stones. In kidney diseases such as polycystic kidney disease, cystoscopies and biopsies of the bladder help rule out urinary tract cancers. Certain foods should be avoided in those with PBS. Top offenders for flare-ups are caffeinated beverages or food, like coffee, tea, sodas, and chocolate. Also, acidic foods and beverages, like cranberry juice, tomatoes, and citrus fruits, can cause irritation. Spicy foods, soy, MSG, and alcohol should also be avoided. In dealing with PBS, support groups, including pain and national support groups, can offer the necessary psychological and emotional support. Pelvic floor muscles support pelvic organs, including the bladder. Strengthening these muscles through certain exercises improves bladder control and helps patients relax the bladder during painful episodes. Medications can be administered orally by bladder instillation or by injection into the bladder through a catheter. Medication treatment focuses on three main actions: pain relief, repair of the defective bladder urothelium, and decreasing the frequency of urination. Neuromodulators send electrical impulses to the sacral spinal nerves in the lower back, which in turn helps manage urinary frequency, and also acts to relieve chronic pain. A neuromodulator can be attached externally, or it can be implanted internally through surgery. As a last resort, surgery may be performed to help relieve symptoms. Bladder diversion surgery has received only marginal success in relieving PBS symptoms. Diversion involves implanting a conduit, which leads to an external urine collecting bag. The bag must be drained by the patient 4 to 6 times a day. Laser surgery may also be performed to remove Hunner's ulcers. This procedure involves removing inflamed tissue using a laser beam or electrical current and does provide some pain relief. Unfortunately, the effect is usually not permanent, and the inflammation often returns over time. In summary, PBS is a chronic condition characterized by pain and pressure on the bladder and pelvic area. There are 2 main subtypes of PBS, including those with Hunner's ulcers and those with just glomerulations. The symptoms of excessive urination and chronic suprapubic pain occur in the absence of bacterial or viral infections. The etiology of PBS is largely unknown, but defects in the mucin layer that allow solutes and toxins to penetrate the urothelium are believed to bring about the characteristic glomerulations and to also activate nerve endings, eliciting pain. There are a variety of medications that are useful in managing PBS. Dietary changes can also be beneficial to prevent flares. Neuromodulators can be used to help relieve pain, and surgery is an option for the removal of Hunner's ulcers. Now for some questions. For assessment, please pause the video now and select your answers. If you answer the following, you are correct. Thanks for watching.